In art therapy, we work with inner symbols, with subconscious thoughts and images that often arise to the surface while creating and expressing in a safe environment. From my experience working with prenatal issues, hidden, suppressed, or difficult emotions often reveal themselves during therapy sessions, especially for women experiencing the trauma of pregnancy loss. Art therapy can offer a gentle and supportive and healing space, allowing them to process their experiences without the need for words. It gives voice to emotions that might feel too painful to express directly. In art therapy, we can tap into the unseen, the unknown, the unhealed, and even connect to our ancestors and repair our family stories. We combine in art therapy symbols, symbolic acts, role-playing, painting, drawing, working with clay, rituals, singing and dancing, all of which allow the individual find closure and begin healing the wound. Grief can be isolating, but working with groups helps individuals connect with others experiencing similar issues, providing a supportive community where women and parents can share and heal together.
Art therapy can heal and heals through several elements. And of course, there are some elements that are more important than others. Some of those are, for example, the relationship between the patient and the art therapist, because you need to feel safe and free and secure to make art, to be creative, to start the creative process. So the relationship between the art therapist and the patient is one thing. And of course, the setting. You have to feel protected. It have to be a safe place where you feel psychologically safe. And then you make art and you enjoy making art as a patient. That is, of course, healing also. But most important is that after making art, you will talk about the artwork with your art therapist. And that's not just talking, because the professional art therapists know exactly how to talk about the art that is created with the patient so that it becomes art therapy. And the session is not, well, let's say it's finished after when the art therapy session is finished, but the process goes on. So you start the process by art making, talking with the art therapist, and in between the sessions, this process keeps working in the patient's mind. So I have great respect for the two art therapy in psychotherapy settings, because it's, according to my experience, a very powerful tool. And it's a great beauty working with art, seeing the patient's creative expression, seeing surprise and wonder and joy. It's fantastic.
My experience as art therapist about how art can heal has been empowered by my very long practice with migrants and refugees. I am also a visual artist, and I was born in Romania while now living for a long time in France. My personal experience with being a migrant helped my understanding of how we can get successful acculturation when living in a new country and a new cultural environment. It led me to greater empathy. Migrants often feel traumatized, isolated, discriminated. They need material help, but also psychological support. Art therapy is very helpful as it is nonverbal. It works beyond linguistic differences, acting on emotions, creativity, self-esteem, and socialization. I can show you a few powerful and expressive art pieces created in my workshop. Here you see a 5 years old refugee boy's creation expressing his need of protection from bombing, but also from his dad's violence. And here you see the difference for an African refugee between a sad and gray painting of his lost home and the colored painting made 1 year later with new hope got by living in a new place. The title is Simply Living. And sometimes even an apparently small change, leaving a city for another, or the city for countryside, or vice versa, might have a big emotional impact. Try art therapy, it is so helpful.
My experience as an art therapist is that images have great healing power. I remember working in the hospital with a 12-year-old girl suffering from severe anorexia and bulimia. She expressed her uncontrollable vomiting in a drawing with big clouds with many lightnings. In the next picture, she drew a huge sun with a gentle smiling face and many colorful sunbeams. The girl called her Mrs. Sunshine, the healing lady. This is a copy of Lady Sunshine. She explained to me that she will ask Mrs. Sunshine to send her 1,000 colorful sunbeams to heal her. During the time when she was in intensive care, not able to leave the bed, I suggested to put the picture of Lady Sunshine in front of her bed and communicate with her by, for example, writing letters. When I came the following week, the nurse told me that the girl could leave the hospital the day before, and that the doctors were very surprised that she stopped vomiting after eating. Because of that, the doctors decided after some days of stabilization that the girl could go home. The day the girl left the hospital, she asked the nurse to give me a letter. The letter was addressed to Mrs. Sunshine. In the letter, she was thanking her for all the colorful healing sunbeams for recovering. This is one of the most impressive experiences I had as art therapist. I'm convinced that art really can heal, and art can connect us with our healing inner power system or power bank, the healing images of our unconsciousness.
Art therapy engages the mind, body, and spirit under the guidance and with the support of the art therapist, a professional who has been full trained and specialized in this kind of discipline. Art therapy offers a wide range of psychological benefits that we can summarize in this way: self-expression and self-discovery. Through the use of various art materials and techniques, people can reconnect with their inner creativity and express themselves in ways that are not possible through words alone. The process of art making can reveal insights and uncover hidden aspects of the self, leading to self-discovery and personal growth. Stress management and relaxation. The creative process involved in art therapy brings a state of flow where individuals are closely related to the present moment and completely absorbed in their art making. This can help release tension, reduce stress, lower blood pressure, and promote a sense of grounded relaxation. Trauma recovery. Art therapy has proven to be an effective tool in trauma recovery, offering a unique approach to it, affording individuals to express and process their emotions and memories in a non-threatening way, allowing individuals telling and rewriting their story, providing a sense of control and empowerment, and regaining a sense of safety and trust. Mental health challenges. Art therapy has been widely recognized as an effective treatment for a range of mental health disorders, as anxiety, depression, eating disorders, and others. The creative process involved in art therapy can help individuals learn regulating their emotions, gain insight about their symptoms, develop coping strategies, and improve overall mental well-being.
Last school year, I had the opportunity to apply the TTIT protocol, Trauma Treatment Through Art Therapy, by Paola Luzzato, with the 6 students, 12 to 13 years old, who attend the school where I teach art, to combat school dropout. I am an art teacher and an art therapist. The session lasting 20 hours for students were 10. Once a month, I had the precious opportunity to compare myself, free supervision offers from EFAT, with Paola Luzzato, Alessandra Agnese, and other Italian art therapists who apply this protocol with different users. The path was highly appreciated by students and colleagues. How can this protocol help to combat school dropout? Because it gives the student a positive personal space within the school, a space in which is not censored, a creative space where he is listened to. He feels like a protagonist of his own life, filling out the evaluation questionnaire and recommending it to his classmate give dignity to the person. Out of the 6 students, 3 had the final middle school exam and passed it. Below are some testimonials. Testimony of professor. In previous year, I had always had a lot of difficulty involving the boy who appeared apathetic and disinterested in all the activities proposed, not only in classes, but also in laboratory activities. Usually the attitude was one of refusal, almost always accompanied by a closed posture, with his head resting on the bench, as if he wanted to sleep, and a resignated attitude. I remember in particular his aversion to the practices of dance that I usually proposed, complaining of a bad memory of nursery school in his country of origin. Instead, I noticed a clear improvement and a desire to be part of the group, totally new for me after the art therapy class. His posture in class has changed lately. I have not seen him with his head on the bench anymore, and often gets involved in discussion and smiles at the jokes of the other companions, and his participation in practical activities has also become conscious and precise. I have noticed this participation even when explaining more narrative topics, often noticing the attentive look he gives to me, to my words, music teacher. Testimony of some teenagers. A teenager, after having done the TTIT protocol by Paola Luzzatto with me, says he is less tense and has spoken more fluently through the images created. In class, he still cannot speak, having thought he had socialized more with some classmates. He has acquired some feelings that were previously hibernated. Another teenager says, I can talk to someone and express myself more easily through images. I have more confiance in the future. I feel less isolated and less ashamed.